healthcare has gotten increasingly complex over the years. You've had different types of specialists treating each patient. You have different disciplines and groups involved in care. It's become just a lot more fragmented. And that fragmentation becomes a huge problem when you think about, the aspiration of really being patient-centered and really being about what that patient needs. And HSX is just a way to connect those multiple different entities that need to be involved to be successful in taking care of patients or individuals, right? Whether it's your hospital, your multiple specialists, there might be different health systems, it's your health plan, it's maybe different kinds of community-based organizations. And so the thing that's really exciting about HSX is that they could be at that nexus and help those multiple organizations be a lot more patient-centered. I think about HSX's data about, you can use it to take care of the individual patient, for their individual care, and you think about, an organization that's responsible for that individual person, thinking, okay, well, that person's now in the emergency room. How do I figure out how to help them where they are right now? Those kinds of notifications, that's something that, we at Independence and our case and condition management team, for example, we use that. You also think about how can you think about, on the broader scale, this wealth of data that we have from multiple different sources, how can you use that as you step back to improve healthcare on a bigger scale, right? Think about that data, do a study, understand what works, what doesn't, what are the next kind of things that we could do, and how might we test whether that's working. And I think that's kind of really exciting uses for data at two different levels. HSX right now was a pioneer as it started to get going in HIEs. I think now the world's gotten a lot more complex. There are a lot of different organizations involved in exchanging information. I think the key for HSX is to think about how do you use this great position that they're in as a trusted entity in this community, by providers, by health plans, by different community organizations. How do you use that position to drive improvements in healthcare? I think the key is to think about those different kinds of users that HSX can have, and sometimes thinking about new types of users perhaps that we haven't had before. So I think a time of change, but an exciting time for HSX.